Welcome to the Retro 21 Studios podcast. I'm your host, M Squared. This is episode 5. Today, I am joined with Dr. Melissa Belli. How are you today, Melissa?
Good. How are you? Thank you for having me.
I'm doing well. This is an opportunity to explore the world of healthcare, and that is your space. So tell us about yourself and what you're up to these days.
Hi. I'm a family doctor, and I live in Portland, Oregon. I've been in practice for 18 years, and I work in a federally qualified health center here in Washington County, Oregon. That's called Virginia Garcia Memorial Health Center. And there we focus mainly on Medicaid patients and Medicare also. And we see a lot of the Hispanic population in my clinic mostly, because the clinic was founded to try to give healthcare to the migrant seasonal workers that come here to work in the farms in Oregon.
You were telling a story about the origins. There was a little girl who had a cut that was untreated.
Yeah, there was Virginia Garcia was this little girl that was, I think she was 6 years old, and she came with her parents who were migrant seasonal workers, and she got a cut on her foot. And she developed an infection and died of sepsis because they were not able to access any health care. So that news prompted a group of doctors to open a clinic for migrant seasonal workers about 25 years ago. And they opened it out of a garage, and they started seeing patients. And now the clinic has grown a lot. We have 18 locations, and we serve about 56,000 patients a year. And we serve the whole community.
Anyone in need. Is that primarily in the Portland area, or is it national, regional?
Mostly in Washington County, which is close to Portland. It's in the outskirts of Portland. And there's a lot of wine country in this area. And there's a lot of nurseries, a lot of tree farms, a lot of berry growth. So those farms, a lot of workers are Hispanic in those farms.
So what is your specialty, Melissa?
I'm a family doctor, so I get to see patients from any and all ages and having any problems. I see a lot of patients with diabetes, a lot of patients with high blood pressure, adults, children, a lot of postpartum care. And we also provide a lot of pediatrics care, so it's the full spectrum of family medicine.
So other areas by way of tech or things that you're doing in addition to the clinic to help bring more efficiency, bring greater value to your patients? I know there are some things on the horizon.
I'm working on an app at the moment. It's called Mind the Moms, and it's an app that's trying to make it easy for healthcare providers to offer patient-centered care for moms, particularly in the postpartum, because we have noticed that a lot of moms just feel like they fell off the wagon in a way after they had their baby. A lot of moms just feel that's the hardest part of their life, becoming a new mom and learning how to take care of a baby. And often they don't really have access to a person that can support them, or they don't have a community of support that they can access easily. So we wanted to create this app to help people prepare for the postpartum, prepare for the logistics of being on call for your baby the whole time. So how to prepare for that? Prepare for it as if you were preparing for a marathon or preparing to climb Mount Everest or something that it's really hard and complex, and I think it needs preparation. So that's one part of the app. The other part is just a community, just basically helping clinics develop a patient community for their patients, for their moms, so that the moms in one clinic can compare notes, that you are able to create a community within your clinic for moms. And there's also access to resources in the community, so learning what services are available for them, trying to do some what we call in medicine patient navigation. It basically that means it's you talk to somebody who knows the system and knows the ropes and can guide you for what is the most efficient or best way to achieve your goals. And then we're also trying to develop a better framework for the providers to offer these services and make it easy for them without having to overload them. Because there's not a good framework of service for the postpartum. There's not like a model of care. So, for example, when you go see a doctor for a prenatal visit or for a pediatric visit, there's a structure for the visit. We know what we have to ask. We have to ask what's important, what isn't. But there's nothing like that for the postpartum period. So we want to create a structure for the providers to provide this service for the moms. And Medicaid, who covers about 44% of all births in the US, recently got expanded and covers moms for a whole year postpartum. But the moms really are not getting a lot from that. They're not getting a comprehensive service. And so we want to be able to create that comprehensive service. So at the moment, the app is in the prototype stage, and we're going to be running a focus group on pilot at the Virginia Garcia Clinic because we're trying to focus on the Hispanic population. They have a higher level of complications than white women, about twice as much postpartum depression. So we wanted to focus on this group because we feel culturally there's a lot of barriers for moms feeling comfortable asking for help. So that's what the app is trying to address.
Melissa, this is fantastic. I love the metaphors that you use, the Mount Everest, or you're going to go on this long, arduous journey, and that's preparing the mothers for what to expect. Then there was the connection side where it provides a mechanism for mothers to share their experiences.
The focus is postpartum wellness and support. It's to support the moms and promote the wellness of the moms, just acknowledging the fact that the mom is the athlete here. And so we just want to be able to have a framework of support for her in order to prevent complications. The number one complication of birth and postpartum is postpartum depression and other perinatal mood and anxiety disorders. So it's a very common problem. And a lot of women, if you look at the statistics, when they say the number one cause of maternal preventable death, it's suicide or overdose. And that has to do with postpartum depression. The postpartum is a delicate period, and not only for the mom, but also for the baby. Because that's when attachment happens, and it's those first 1,000 days of life is when a lot of our health and well-being it becomes established for the rest of our lives. A lot of these moms that have to deal with a lot of adversity from a socioeconomical standpoint, when you talk about social determinants of health, they're struggling with housing, they're struggling with income, they're struggling with education, with being a lot of them separated from their families. In low access to healthcare. And the reason why I became interested in this was because myself as a doctor experienced a very hard postpartum with my first child, and I had all the resources and all the knowledge, and I had none of those. How do they survive when they also have to deal with all of these other adversity?
I like the way you characterize that second stage from a wellness perspective. And I imagine there's a preventative aspect of that. So you worked in that first phase of preparing folks of this journey. And then the second piece is around wellness. And certainly folks could come into that phase in an adverse state, like the depression that you described. But sounds like it's more of a preventative exercise once it's up and running.
It's mostly prevention. How to prevent becoming burned out. Not sleeping, not eating well, not having breaks, and not having support, feeling isolated. These are the things that cause a lot of stress and health problems are poor nutrition, low sleep in general, just lack of sleep, and isolation. Those are the three main things that determine wellness.
You also mentioned in the context of wellness, having that opportunity to talk to others who are in a similar situation.
Yeah, and that's where the community comes in. Peer support is super important. And if you talk to any moms, they will tell you that one of the hardest things that they went through in the postpartum was this sense of isolation. They feel like a lot of what they're going through is a private thing, that it's a little bit embarrassing to be around other people because the kid's screaming because you have to pull your boob out every 2 seconds to breastfeed, and or you have like complications and a lot of people developing incontinence after having a baby. So it's like you're recovering. So it's not an easy place to go out and hang out with people. So the ability for other moms to connect with each other and people who are on the same boat and are aware of the fact that it is a particular situation that requires a certain space for connection.
That's awesome. And so then I love this holistic approach. And so then that next phase actually brings in the providers, trying to match folks up with the appropriate provider or a more of a professional support mechanism.
There's a lot of research that shows that Hispanic women in particular feel that they need like connection with the doctor to be able to feel or understand better. They need to give themselves. If you give them a handout, they don't feel like they really, like Hispanic people in general, we really need a lot of personal contact, one-on-one, face-to-face. That's the kind of thing that works the most. And the providers from the doctors have a lot of respect and trust. There's a lot of respect and trust for doctors in the Hispanic community. So that is a very valuable connection. It's a therapeutic connection. And people who are doing PhDs in the subject have said, we need the providers to really step up and be there for this population. More experienced moms may not need that. More experienced moms may be fine and not need that. But especially first-time moms, a lot of Hispanic moms are teenagers or very young. We need to be there for them, and we need to hold their hand and be a maternal figure, because in modern society, there's hardly any more of the sort of wise woman is not around. And so we need to occupy that space.
Wow. That's awesome. Melissa, I know you guys are working on this app. You mentioned where you are in this process, and I would love for you to come back on for a future episode and we could actually walk through the application. So tell us more about where you are with the app and any support that you need to move this forward. Sounds like there's a great need out there for this.
I was invited to pitch my app at NIH recently at Innovations for Maternal Health workshop. And I pitched it there and I made a lot of connections, and I'm applying for a grant because funding is always the rate limiting step for this type of thing. So I'm applying for a grant at NIH, and I think I'm going to apply to other grants. The idea that we have is that we want to create a solution that doctors and medical systems can use to offer their patients for free, because these patients are not going to pay for an app. So we want to make it accessible. We wanted to make it equitable. I also feel like equity starts during pregnancy and the first 1,000 days. Because if that's when your brain is developing, it's when the baby's brain is developing, and a lot of your health and your epigenetic expression is being determined during that period. So if the mom, let's say it's exposed to a lot of stress, is nutritionally deficient in many nutrients, and is stressed, that influences a lot of that baby's future. So we are looking for grants, and we're looking for support and other researchers that are interested in helping out, because in order to obtain grants, it's always better to be affiliated with a university. So I'm in discussions with a couple of researchers. I'm also in discussions with Postpartum Support International, and if we can figure out a way of working together.
Excellent.
But at the moment, mainly that they're trying to find funding to really bring this project forward. The first reason why we need funding is that we want to run a really good focus group and pilot, so that we can really create this tool with the moms, with the community that's going to use it, so that we actually create a tool that's going to be useful for them, and that they are going to want to use. We have a prototype at the moment, but we have to test it, and a lot of the content at the moment is in text, and we want to be able to create videos of it.
Got it. From a timing perspective, so you describe the train has left the station, right? There's a need out there in the community right now. There's folks who need this service. And I imagine there's not enough doctors to go around. So it sounds like this application would be a force multiplier. And for folks who are interested in learning more about the app or maybe wanting to help from a funding perspective, is there a way they could get in touch for this purpose?
Yes, we have a website. It's www.mindthemoms.com.
Mm-hmm.
There is actually a donate button there. So that's a really straightforward way. And then if they want to contact me, it would just be my name, Melissa Belli, Belli, at mindthemoms.com.
Oh, that's awesome. Any unique technology going into the app? There's so much happening in the AI tech space right now that could potentially be a force multiplier as well. Have you explored any of those areas?
At the moment, it's a web app. So because we wanted to make it a web app so that it was accessible to any type of phone that people may be having.
So they have the mobile presence.
We don't want to just limit it to the app store. So it's a web app. It is at the moment a low code app that I developed myself. One of the main things that I would like, that I dream about, is how to connect it with Epic, because I think that's going to be critical. For example, if we want to send patients a questionnaire, there's certain recommendations, like new recommendations that you have to screen for postpartum depression at certain intervals, much more than we're currently doing. Currently, we're just doing screenings at the 6 weeks postpartum visit in most medical practices. Mm-hmm. So the new recommendations are that we check a lot more, like within the first couple of weeks, and that we check monthly after that for several months, and then every couple of months. There's a schedule, and recommended by Postpartum Support International. So it would be great if we could send from my chart, if we could send automated, that we could send these questionnaires through my chart to patients. It would be also great if we could screen for the risk factors of depression through my chart.
Okay.
It would be great if the providers could actually get some awareness of what the patients are currently doing, what things are they struggling with, so that when they actually come for the visits, you already have an idea of what they need. And then maybe put the structure of the visit within Epic. My latest technological issue would be how to link it to Epic.
How to link it to Epic. And so for those in the audience who are not familiar with Epic, what is Epic?
Epic is the biggest company doing electronic health records. So there are most clinics in Oregon, most doctors are using Epic because the electronic health record. And so connecting with Epic would be the very good. And in fact, Epic has something that's called a it's called Epic Care Companion. So they actually have this mechanism by which you can put in there things that you want the patients to get. So there is a mechanism. It wouldn't be so hard. It wouldn't have to be created again. It would just have to be connected in a way.
So, Melissa, as I mentioned at the beginning, it would be awesome if you'd be willing to come back and we could stay apprised of where the application is going. This is a worthy cause, and you've put a lot of effort into it.
Yes, thank you. Thank you for the opportunity. And I definitely need help getting the word out because when you're trying to do these things, you're focused on the problem and trying to solve the problem. But a big part of this is getting the word out and finding like-minded folks that want to help out and guide us, because like finding somebody that's really good at connecting with Epic would be a great thing.
Okay.
People that are knowledgeable about grants, funding, other funding sources that we can access, even government organizations that could be interested in a project like this.
How do folks get in touch with you? And if they want to provide funds, what was that web link again?
It's www.mindthemoms.com. Mind the Moms.
Mind the Moms. I love that.
Yeah. Yeah, I came up with that name because it just made me think about, you have to think about the moms because they're the best advocate for the family, for themselves, for the babies. And if we support them, I think we could improve. I really do think we could make the world a better place.
Oh, most definitely. And as we're wrapping up, it just brings up yet another question. As you mentioned that the focus is generally on the baby and the mother is sometimes neglected throughout that process.
Yeah, in a way, we're superwoman because you have to do all this stuff, but it's considered normal and expected that you do all this stuff and not easy.
So, Melissa, you're running this app. Is it just you or are you involved with others?
Yeah, I have my co-founders. Amy King is one of them. She's a PhD in psychology. She's a clinical psychologist, and she's a advocate for a pediatric improvement and resilience in pediatrics. And so she's one of our co-founders. And there's also
Mm-hmm.
Jen Hannes Martin, who is a sociologist, a PhD in sociology, who's also helping out with the research part and also her experience as a mom. And she did a thesis on sports and moms. How do moms continue to do sports during the postpartum and how that benefits their health? So we were trying to integrate their life experience and their knowledge into the app. And I'm also collaborating with Adriana Soto Spina, who has another app herself that we're trying to bring together. Her app is a postpartum and prenatal and postpartum coaching app, basically, with actual live people that you can talk to.
Oh,
And
wow.
so we're trying to bring that together. And additionally, I'm bringing on Damaris, and she basically is a person that started working at Virginia Garcia when she was 18 years old, and she became an RN. And she was
Mm-hmm.
like a 3-day nurse. And so she would go to people's houses to follow up on the babies and just wait the babies. And so she knows that community very well. And she worked there for very many years. And now she's a psychiatric nurse practitioner and a specialist in maternal mental health. So we have that team bringing together our ideas and our experiences to bring this solution.
Wow. Melissa, I certainly appreciate you taking the time to share Mind the Moms app and then providing a perspective that I wasn't totally aware of, but your patients, the folks that are working in the vineyards and in other areas out there and the challenges that they are currently facing. So just providing that insight and perspective it's been enlightening.
Thank you.
I appreciate you joining.